Okay, we've had some requests to talk about anxiety. So, what I'd like to do today is kind of cover the mechanisms and physiology that's related with anxiety disorders, and then talk about treatment applications, talk about how nutrition plays a role, and really try to answer some questions that people may have. So, if you can give me about 15 to 20 minutes to review some of the concepts, then we can get into specific questions that you may have. So the first thing to realize with anxiety is that it's not the same mechanism for everyone, and there is actually known pathways how anxiety is developed. So for the most part, there's an area in the brain, or a region in the brain called the limbic system, and within the limbic system, this is our emotional brain. We have areas in the brain, like the amygdala, that are involved with triggering the response that we call anxiety. And really what anxiety is there's areas of the brain that are part of the autonomic nervous system that really raises our so-called stress hormones, like catecholamines. These are things like adrenaline. The adrenaline is really also known as epinephrine, norepinephrine. And our body releases epinephrine, norepinephrine to increase our heart rate and to really get blood flow to our muscles and dilates our pupil so we can deal with an acute stress. Like if someone was attacking us, we would want to have our anxiety centers activated so we can change our autonomic dynamics and be able to see more of the world with our pupils dilated and have our heart rate go up so we get more blood flow to our tissues and be able to escape and get out of an acute crisis situation. So anxiety also heightens our sense of sound and light. It activates an area in the midbrain called the superior inferior colliculus, where we become much more sensitive to light, much more sensitive to sound. We become much more aware of quick movements. So that's all part of a normal physiological response that's there to really protect us from any type of acute stressors. So that's the normal healthy response, to have these areas of the brain, the amygdala, the limbic region, to deal with anxiety. And these areas of the brain are activated by other regions of the brain and by metabolic factors. So when you look at a person that has anxiety, the first thing to realize is that the limbic regions of the brain and their physiological response to stress is either being driven too much or not able to be dampened. Now, the chemicals that can activate this could be epinephrine, norepinephrine. So if you have too much caffeine, for example, too much nicotine, you could get a little anxious. So catecholamines like norepinephrine, epinephrine are stimulated by stimulants. We also know that psychological responses can activate this area of the brain. So there's areas with the frontal lobe with reasoning that can activate the limbic regions. Your ability to evaluate the environment and know what's stressful activates this area of the brain. There's areas in the brain called the vestibular system, the cerebellar system, which are involved with controlling your sense of position and balance. And if you feel like you're falling, then these vestibular cerebellar regions have to fire directly into these anxiety centers, so you can get your heart rate up and your adrenaline up to respond to the fall. And then there's an area in the brain called the basal ganglia, which basically calms this whole area down and dampens this area, and that's done through GABA. So in a real clinical setting, when someone has chronic anxiety disorder, you have to make the assumption of like there's something happening with these regions of the brain. Either they're being activated inappropriately for some reason, or they're not able to dampen the area, or there are metabolic issues. For example, underlying undiagnosed overactive thyroid, hyperthyroid response. Someone who has Hashimoto's, where they have breakdown of their tissues and thyroid hormones released in the bloodstream, that can raise those catecholamine levels. So those are, kind of like the landscape, the big picture of what's out there. So if someone has anxiety, it's normal for all of us at some point to have anxiety. So there's normal anxiety and there's an abnormal anxiety. It's normal for us to have anxiety if we have fear, if we're worried about something. That's normal. And then there's mechanisms where someone will have anxiety for no reason. They'll just be reading a book and just have a serious anxiety response. There's people that have exaggerated responses to anxiety, to the stress responses. For example, someone can say boo and scare them, and then they're freaked out for the next 2 days, and they can't sleep and they can't calm down. So, we got to first of all distinguish normal versus abnormal, and we have to realize different regions of the brain that are involved, and it's this complex interplay that's there. So, with that being said, anxiety is not a nutritional deficiency. Anxiety isn't a specific neurochemical imbalance where you just need more serotonin and more dopamine. It's not that simple. And this is why many people have anxiety don't really have effective treatment that helps them, because it's not a single variant model where you just take a anti-anxiety medication or you take a nutritional supplement to fix it. It's really more complex than that. Now, those things can help take the edge off, but they're not necessarily the mechanism that's there to begin with. Okay, so let's go into like a clinical scenario where we have someone that complains about anxiety. Okay, now the first thing to really make sure it's clear about anxiety is there anxiety is there anxiety caused by an abnormal physiological response, or is it caused by a normal response that just is not being accounted for? So if someone has a lot of inability to cope with stress, like they have lots of things on their plate and they don't know how to cope with it, they don't have coping mechanisms to deal with their life, whatever that may be, then that's just that's not necessarily a physiological anxiety imbalance. That's just a person who doesn't have coping skills to respond to stress, and they may feel like they have an anxiety disorder, but they really just truly have an inability to handle their workload or have coping skills to handle the amount of demands for them. And for them, it's an easy fix. If they can reduce those factors, then their system calms down. But sometimes when people are actually in the grind and they're actually into that system, they just don't realize it's that, and they're trying to reach for different pharmacology applications or different supplements to change, and that's really not this. That's really going to have limited effects. So all of us have some degree of workload and tasks that we can handle, and we all have some ability to cope with that. For some of us, it's exercise. For some of us, it's a combination of things. It's talking to friends and family, developing a plan, getting enough sleep. Those are key things. So that's all falls under normal physiological responses. That's not really what I want to focus my talk on. If that's the situation, then the key thing is to deal with coping skills. Coping skills, again, the most common ones are exercise, even meditation, reducing the workload, getting sleep. Those are normal ways to deal with anxiety when it's related to being overloaded, and that's part of it. Now, the next part of it is really related to the other type of anxiety. Is anxiety that does not make sense. Like if someone, I'll give an example. Someone comes in and goes, I'm retired, I'm financially secure, I don't have to do anything, but I have anxiety all day. That's different. They don't have a workload. They don't have too many issues. They just have anxiety. Or for other people, life is great, I'm so happy, but I went with my friends outside and I had severe anxiety. My heart rate went up, I started sweating, I started having a panic attack. I don't understand why. So that's a totally different scenario. So sometimes it's very easy for patients to confuse those two things together. So let's talk about the ones where things just don't make sense. Okay. Now, first of all, when we get into anxiety disorders, there's a few things that we know research has shown us. There, first of all, are some genetic uniquenesses that we have in our neurochemical pathways, which means that we don't, as a human species, respond to stress all the same way. Some of us have increased sensitivity of what are called adrenaline or catecholamine receptors, which makes our limbic system really, really responsive to stress. And some of us have genetic uniquenesses where the pathway that calms down the areas of the brain that lead to the anxiety response through GABA is an inhibitory neurotransmitter, isn't working as well because of our receptor sites genetically. And in those cases where you have a neurochemical genetic imbalance, the key thing is it's pretty clear in the family history. Every single sibling will have the same thing. Parents and their family tree of parents will have the same thing. And then that's a different scenario. So there are some different degrees of uniquenesses and responses to stress based upon our what are called single nucleotide polymorphisms, or each of us have some gene uniquenesses that separates us from each other. So some people are just a little bit more sensitive to stress. And in those cases, any type of imbalance in these stress pathways can really be a factor. Not to say you can't do anything, but just know that there are differences between different people and different patients. Okay, now the other key thing is for people that have these genetic sensitivities, like they can do subtle things that really throw them off. For example, if their blood sugar levels drop, if they're hypoglycemic, that can really flare up their anxiety. And one of the most common causes of that is for a person to just have extended periods of time where they're not eating, or if they eat, they basically have like tea with honey all over it, honey in it, lots of sugar, lots of sweets. They might have fruit for a meal. They might have a smoothie as a snack, and then have a blood sugar crash. When a person's blood sugar levels drops, one of the pathways where we compensate for that drop in our blood sugar levels is to have our adrenal glands release adrenaline, catecholamines, to help break down what's called glycogen in our liver to get our blood sugar levels back up. Well, that adrenaline release is going to still activate the areas of the brain, the amygdala and limbic system, and it can cause anxiety. So one of the key things to know is if you have a tendency to have anxiety in your family, if you have a hypoglycemic lifestyle, it's going to absolutely be expressed more because you probably have receptor sites that either can't shut down stress or have an exaggerated response to stress. And when your blood sugar levels drop, you increase your catecholamines and you will have anxiety all throughout the day. Now, your clue that that's happening to you is you basically lose function, and in between meals where you can't think, you can't focus, you get shaky, you get lightheaded, you see a blurred screen, and then you finally eat, and then you feel better again, you can function again. If that's happening to you on a regular basis, that means you have low blood sugar levels. Your blood sugar levels are dropping throughout the day. So you have to eat more frequently, eat more protein, eat more fat, cut down on the amount of fruits and sugar you eat, and get stable. And that can have a huge impact on impacting your anxiety. Also, if you have some genetic uniquenesses to having anxiety, or for whatever reason you have anxiety, physical exercise can burn off these adrenaline levels. So when you have this anxiety response, you have all these adrenaline levels, catecholamines in your system. Sometimes when you exercise, you can burn those off with physical activity. Like I'll have some patients that have anxiety disorders for various reasons. And once they get an anxiety response, they'll have to maybe do a 10-15 minute high intensity workout, or get on a treadmill or get on a bike and just burn off their catecholamines, and then they can sleep that night and they can function. So that's one issue with that. Now, the unfortunate thing is we don't have conventional laboratory tests to measure all the different gene uniquenesses that make some people more sensitive to anxiety in a clinical model. They're done in research studies. They're not those complex genetic uniqueness markers called SNPs are not available in commercial settings for us to just go and screen someone to test them. That's the lag we have with what's being published in the literature and what we have. So one group of people have genetic issues, and if they have genetic issues with sensitivity, it's in their family tree. They know it's a clear family trait, and for them the biggest issue is to burn off catecholamines when they have an anxiety attack, to make sure they're not hypoglycemic, and that is a key approach to that. Then you have another group of people that have anxiety, and it's just completely brand new. They never had it before. There's no family history of it, and it's acute. And whenever that happens, you got to make sure that you don't have hyperthyroidism or Hashimoto's or autoimmune thyroid. That's a metabolic condition where you can have your immune system attack your thyroid, and when the immune system attacks the thyroid tissue is destroyed, and then thyroid hormones are released in the bloodstream, and thyroid hormones increase the metabolic rate, and they also sensitize catecholamine receptors in the brain and the anxiety center, so you can develop anxiety. So if it's like an acute onset, it's never before happened, you start having anxiety all the time, you got to make sure you don't have any underlying tumors that can raise catecholamines, which is really rare. And you got to make sure you don't have Hashimoto's and autoimmune thyroid issue. It's just some routine lab work by a primary care physician, and your healthcare professional should be able to rule those things out. Now, the most common cause of anxiety that I see in my practice, which could be skewed because of the population I serve, are people that have brain dysfunction that causes anxiety. So when I say brain dysfunction, I mean they have had a traumatic brain injury, and over time, they start to develop anxiety. They have neurodegeneration taking place, and now they're starting to develop anxiety, and they don't even understand that it's neurodegeneration taking place, or they're a child with a neurodevelopmental disorder. So, what I've seen in my own practice as a clinician is when I work with patients, the most common cause of anxiety is really brain imbalances, not necessarily brain disease. In the early stages of neurodegeneration, it's not really considered brain disease. People that have traumatic brain injuries, once they get out of their acute phase, they're pretty much ignored. They don't, healthcare professionals don't understand that traumatic brain injuries have far-reaching effects downstream years later, so they get ignored all the time. And then some children have neurodevelopmental disorders. They get so labeled with their neurodevelopmental disorder where they call it ADHD or autism or anywhere along that spectrum, that they get labeled with their disease, and they don't realize their anxiety is really caused by their imbalances in the brain. So brain dysfunction, whether it's neurodegeneration, neurodevelopment, or injury, are the most common causes that I've seen cause ongoing chronic anxiety issues. So what do you do for them? How do you treat them? How do you evaluate them? Let's talk about that a little bit. So let me tell you a really common one. A really common cause of anxiety is anxiety that's associated with cerebellar disease and cerebellar degeneration. And cerebellar degeneration and early cerebellar neurodegenerative diseases are really not typically diagnosed because there's no MRI changes yet, and their examination findings are pretty subtle. The patient may notice that their balance is worse than before. They may notice that they're more motion sensitive than before. And the key thing with them is when people start to have degeneration in their cerebellum is they start to notice that they may not even notice this, but what you'll find with their history is that when they're in an environment with lots of motion, lots of movement, that's when their anxiety gets worse. So if they're at home alone, they're fine. If they go outside with lots of people moving around, walking quickly, their anxiety could be flared up. If they watch TV and they watch a movie and there's quick screen changes, they can get their anxiety to flare up. They can feel nauseous. They can feel their heart rate go up. Those are all associated with cerebellar dysfunction. Now, the key thing is there's an area of the brain called the cerebellum, and the cerebellum is common to degenerate. It's very common to have neurodegenerative changes there with people that have celiac disease or Hashimoto's, because celiac disease produces gluten antibodies, and these gluten antibodies have been shown to attach to the cerebellum and cause neurodegeneration there. Same with patients that have hypothyroidism with the Hashimoto's cause, being an autoimmune response for the thyroid disease. They have TPO antibodies, and those TPO antibodies bind to the cerebellum also, and they cause excessive degeneration and inflammation there. So gluten ataxia patients, Hashimoto's patients, they're at risk for developing early neurodegeneration of the cerebellum. Type 1 diabetic patients also have a similar antibody called GAD65 that causes this area of the brain to start to degenerate a little bit earlier. And when the cerebellum starts to degenerate a little bit earlier, there's a few things you'll also notice if you look at them. One of them is if you check their handwriting, they get something called macrographia. So if you have them write a sentence like "today is a sunny day," and you have them repeat that 20 times on a piece of paper, you'll see their font getting bigger towards the end. And that's called macrographia. The cerebellum is involved with fine-tuning motor movements, like handwriting. So as the cerebellum is not healthy, as it fatigues, the handwriting gets bigger and bigger over time. So that's one big clue. Sometimes when I look at patients' intake forms, I'll just see their handwriting getting bigger as they get to the last forms, and you can see, okay, well that's the sign of cerebellar disease. Walking with their feet wide, like walking like a duck, that's a sign that their balance is off. If they close their eyes, they kind of sway all over the place. They may notice if they reach out for something, right at the end of reaching out for something, they get a little tremor. Like if they touch their nose, they get a little tremor right before they hit their nose. Those are all signs of early cerebellar degeneration. And when the cerebellum degenerates, what happens is motion and movement abnormally excite the anxiety centers. and then they get chronic anxiety because of their cerebellum issue. So the way this works is motion and movement come into different ear canal pathways in the brain and to the cerebellum. And when you're basically moving and functioning through life, these areas in the brain are helping your brain, and your brain tell you where you are in space. But when this area of the brain is degenerating, it can't dampen and coordinate these movements, and there's an abnormal escape to these sympathetic centers. Remember, the area of your balance centers, your vestibulocerebellar system, are intact, and they are directly linked to your anxiety sympathetic responses, because if you fall, you got to trigger that response. So people that get cerebellar disease can actually have this area of the brain degenerate, and they have inability to dampen those inputs, so it abnormally fires for the anxiety centers. So those are patients that have anxiety related to an area of the brain called the cerebellum that's involved. And the key diagnostic thing with that is motions, movements, quick screen changes can really increase their anxiety. And they become very sensitive to light, and they really can't handle action flicks. They rather watch black and white movies, old movies with slow screen changes. And there's no way to treat their anxiety directly. You have to really improve the health of their cerebellum and manage their gluten ataxia, their celiac disease, their thyroid disease, and start doing rehabilitation, neurological rehabilitation for the cerebellum, which can involve all types of things, but typically things like balance exercises and so forth. Okay, so that's one area of the brain that's involved with chronic anxiety that gets misdiagnosed in the healthcare system all the time. Another area of the brain that's involved with chronic anxiety issues is changes in the frontal lobe. The frontal lobe is the area of your brain that's involved with executive function. And the frontal lobe activates a pathway that dampens these limbic areas of the brain that cause the anxiety response. And these are pathways that are called the frontostriata cortical limbic projections, and they dampen the anxiety response. So when people start to get frontal lobe degeneration, they lose the ability to dampen their stress responses. Now, your biggest clue that someone's getting a frontal lobe degeneration is they can't focus like they used to, they can't concentrate like they used to, they can't finish tasks, they have problems with planning and organizing, and they have reduced attention spans than they used to in the past. And that can happen from an injury to the brain, that can happen from neurodegeneration. And kids that have learning disorders where the frontal lobes aren't developing, like especially kids with ADHD, they tend to have anxiety because they can't activate their frontal lobe, which has projections to dampen the anxiety centers. So in those cases, you really have to improve brain health, try to if it's a neurodevelopmental issue, you got to get these kids to optimize their brain function, physical activity, exercise, anti-inflammatory diets, and those types of things could be encouraged. And if it's a neurodegeneration issue, it's the same thing. You got to focus on improving your brain in those scenarios. Now, I wrote a book on nutritional pathways and lifestyle approaches to impacting brain function that's available if you're interested in it. It's called Why Isn't My Brain Working? And if you go to our website, Dr. K News, there's information about the book. And I also have an online program called Save Your Brain that gives you strategies to use diet and nutrition and lifestyle to improve your overall brain function. And for some people, that can have an impact on improving their cerebellum or frontal lobe issues to some degree. I mean, there's only so much you can do without a specific exam, but some general guidelines can make a big difference for some people. So we talked about the cerebellum, we talked about the frontal lobe. There's a third area in the brain that is commonly involved that causes chronic anxiety issues, and that's the area in the brain called the basal ganglia. In the basal ganglia, in kids, we talked about this with PANDAS. PANDAS is where you have an infection, something like streptococcus, where antibodies are made against streptococcus, and those antibodies have molecular mimicry, and they bind to the cerebellum, and they cause injury there. And then this area in the brain called the basal ganglia can't dampen the limbic amygdala areas that cause anxiety. So past infections can do that. In older individuals, one of the most common areas for silent stroke is a little vascular infarct in what are called lenticular striatal arteries. And they get these little small little strokes there. And then all of a sudden they have anxiety ongoing from that point of view. And then it's very similar. Some of these people get strokes in the basic ganglion. They also develop things like restless leg syndrome from like never before. All of a sudden they have restless leg syndrome. They have anxiety. Whenever that happens, you really have to make sure you get scanned for small microvessel disease because you might be having silent infarcts and strokes all the time. So those are the common brain pathways that cause anxiety. So, for the most part, this is the unfortunate thing is this is kind of complex stuff. And just because you can identify the areas of the brain that are involved doesn't necessarily mean you know how to fix it. And even in a clinical setting, sometimes you find someone who's got frontal lobe degeneration or injury or cerebellar injury or basic ganglionic injury or past strokes. And you can try to improve that function, but the point is everyone will have different responses to treatment. So then at the end of the day, you're going, well, if you have anxiety and you're trying to find the cause and fix it, what do you do? Well, without question, exercise and studies over and over again seem to help with anxiety. So that's one key thing. You have to have physical activity. The literature is very, very clear. It doesn't even matter what your cause for anxiety is. People who move, people who have exercise have less anxiety. They're burning up catecholamines, they're making the brain more efficient. So exercise is a part of it. Now, if you have a if you have a brain that's injured, you may have to be very careful with that overstimulating yourself. Because for some people, like they'll do yoga and they'll exceed their brain's endurance, and then they'll get more anxiety afterwards. Or they'll go for a run, but there was so much movement and motion when they went for the run, they get anxiety. So they have to like sit at home with a stationary bike and not have a lot of movement so they can get exercise but without feeling overstimulated. But people that have anxiety unrelated to the cause have to find a way to exercise that has profound impacts clearly published in the literature that can make a difference for people. Not saying it's going to cure the underlying mechanism, but it's going to improve how much anxiety they express throughout the day. With that question, the literature shows caffeine, nicotine, alcohol always make anxiety worse. So those are pretty clear things. And then as far as therapy goes, things that can have a direct impact on the brain, like things like there's various cognitive therapies that impact the brain, neurofeedback, biofeedback. Those are most effective if there's a frontal lobe mechanism that's involving anxiety centers. May not do much for people who have cerebellar disease. May not do much for people who have Hashimoto's. And that's the other thing. What may work for one person may not work for another person because of the underlying mechanisms. And these mechanisms I'm talking about are subtle. This is why when they do research on anxiety, they don't account for all these different variabilities when they develop a study design. So they don't ever get enough of one group to evaluate. And there's a lot of confounders there, so they can never really reach statistical significance with any kind of form of therapy. So they find like nothing really works. But in a real clinical setting, when you can just look at one variable, one mechanism, many times you can develop a personalized lifestyle approach to help them. And so you've got to try different cognitive therapies, biofeedback, neurofeedback. Your response would be totally into someone else's. Deep breathing could be an issue. Brain rehabilitation can be a key factor. If you ever had traumatic brain injury, you may want to work with someone that does brain rehabilitation to really help activate and regenerate the brain, even if the injury was 5 or 10 years later. Now, there's lots of natural supplements that also have an impact on the brain. The most common ones, like valerian root extract, is very powerful. And valerian root extract, it's not very powerful. It has an impact. Valerian root extract has valeric acid. It crosses the blood-brain barrier and binds to GABA receptors. Passion flower extract is a natural herb that has calming effects on the brain. Kava kava, which I think has now been removed from the U.S. market, has an impact on activating GABA receptors. Phenobut has also been removed, I think, in the U.S. Well, it has been removed in the U.S., but phenobut is a natural compound that impacts GABA receptors. But besides kava kava and phenobut being removed, valerian root, passion flower, the amino acid L-theanine, they all bind to the GABA receptors, which calm down the anxiety response. Those can all be natural things that are used. Lithium orotate, the actual mineral, not lithium carbonate, the drug. Lithium orbonate has been shown to kind of dampen the anxiety response. And then magnesium threonate, THERONATE. Magnesium threonate is really one of the best forms of magnesium to deal with anxiety because it can actually cross the blood-brain barrier and have an impact on neurochemical pathways in the brain. So, if you're dealing with anxiety and you're trying to find nutritional supplements to take the edge off, that's the main list: valerian root, passion flower, L-theanine, lithium, orotate, the mineral, magnesium threonate, and then if you have access to kava kava, phenobut, in your country, wherever you live, those are very powerful ways to also support the GABA pathways. For some people, it'll make a difference. For some people, it won't. And some people will actually need to use pharmacology to deal with their chronic anxiety responses. So that's kind of the landscape with anxiety. I know it's not like black and white, and there's all these different variables there. And I wish I could give you a silver bullet if you're suffering from anxiety, but it is complex. And I know, even for myself, when I work with patients, and this is one of the things you're dealing with, I'm always, I could say, intimidated, because you have to figure out these pathways, and hopefully you can find something that makes a difference for them, but it's not simple. Okay. Hi.
Hi.
My darling wife's here to help me.
Yay.
Questions?
Hi.
Hi.
Your camera is so close to your face.
I know. I don't know how to
It's
fix
okay.
that.
No, it's probably better just to leave it at this point. But
Yeah. Sorry about the close-up, people. I don't know why. I don't know what Facebook does. Facebook Live keeps changing, and now all of a sudden...
I'm like, I can see you shaved. Yay.
Yeah, sorry.
Okay.
I don't mean to do a close-up.
I like seeing your face, so it's okay. Okay.
I'll move it.
Ready?
Yeah.
Okay. So John Lynn's asking. I'm sorry, I missed the last little part, so if I'm repeating questions, sorry.
You missed the best part, but go ahead.
Darn it. John Lynn's asking, does anxiety cause or produce or release more histamine?
No, histamine is an excitatory neurotransmitter, but I would say no, because you don't see people that have anxiety all of a sudden start itching and scratching and having a red nose and all the symptoms of a histamine reaction, histamine response. But if you have high histamines already, for whatever the reasons are, catecholamines that are released during a stress response, they do sensitize the histamine receptors. So your allergies and your sinus and your redness, your skin reactions can all get worse under an anxiety stress response. But the actual stress response itself doesn't release histamine. So it just amplifies the histamine response that may already be there.
Okay. So Genevieve's asking, does diurnal anxiety, terrible in the AM but non-existent in the PM, suggest a certain pathology or mechanism?
Diurnal? Okay. So the anxiety is only happening in the day but not at night?
Terrible in AM, non-existent in PM.
Yeah, whenever I hear about anxiety and it has a timing pattern, it's probably not metabolic. It's probably related to brain. And the first thing I would think about, what are things that are really triggering your brain response? To be honest with you, I don't know what that specific thing would be. I would need more information. But there is not a clear known mechanism if you're having anxiety more just in the morning and not at daytime. I would only guess that it's brain based. Now it could be, for example, your frontal lobe basic ganglia pathways aren't working, and as you activate yourself and get movement in and get some activity going, that pathway starts to work and it starts to shut down. Like people that have the frontal lobe basic ganglia part of the brain not able to dampen their anxiety centers, like if they'll know if they don't go for a run, they can't calm down their brain. If they don't get some movement in, they can't calm down their brain. So when they are first rested and their brain isn't activating and they just kind of first wake up, it's worse. And then once they get moving, once they get activated, it can all calm down. But for me, it's still screaming brain, but I don't know specifically what those things are. So, sorry.
Okay. Tammy's asking, can you share what type of valerian to use? Is it standardized capsule work, or do you need to have? Oh, it needs to be an extract.
Oh, valerian root, valerian extract, valerian root you find at the health food store, they're all pretty much the same. They all contain valeric acid, and valeric acid crosses the blood-brain barrier. Now, I should also point out what we know about GABA, which is the pathway that's activated with all these different nutraceuticals, is that there are GABA A receptors, GABA B receptors, and GABA C receptors, and there's at least over 20 variations of these A, B, and C receptors. And some people respond better to passion flower because of their GABA receptors, and we don't know which specific GABA receptors that each of these natural compounds bind to. because people haven't really wanted to search 24 different pathways for valerian root GABA activity in the literature so far. So some people respond better to L-theanine, some people respond better to lithium, some people respond to passion flower. Everyone's a little bit unique, and that's the other problem. There is some trial and error when you have anxiety to figure out things that work specifically for you. This is definitely one of those conditions where a personalized approach is key because it's so different from one person to the next.
Okay, so there's quite a few questions on GABA.
GABA. Okay.
Can you? So I'm going to combine them. Okay.
Okay.
Can you comment on the GABA test?
Yeah.
GABA
test.
GABA test.
Okay.
They're just asking. Does oral GABA cross the blood-brain barrier?
Okay, let's start with the first one. Can I comment about the GABA test?
Yeah.
Well, I'm assuming you're saying GABA test, you're talking about urinary neurotransmitters.
It doesn't say, I'm sorry.
Okay,
Yeah.
so urinary neurotransmitters are totally unreliable for what's happening in the brain. Urinary neurotransmitters are a total joke when it comes to assessing anxiety and brain disorders. Some labs do it. I know, like some of the labs that do urine hormone tests are throwing those in as part of a test. They tell you nothing about what's happening in the brain. I actually published a paper that was titled Non-Validity of Neurotransmitters, Urinary Neurotransmitters. And in that paper, I just went through the literature, and it's very clear that the amount of neurotransmitters you have in urine have no reflection of what's happening in the brain. Even within the brain, the amount of GABA or serotonin or dopamine you have in your frontal lobe versus your mesencephalon versus your hypothalamus versus your limbic area are all different. They have no correlation with even CSF levels. And what you're actually seeing in urine with things like GABA or neurotransmitter levels, urinary neurotransmitter levels, or things that are being produced in the gut, things that are being produced in the kidneys. They have their own local effects, and they have no reflection of what's happening in the brain. It is an absolute red flag if you're working with a clinician and they're trying to look at your urinary neurotransmitters to figure out what's going on with your brain. It's something you should be worried about. Okay, what's the second part of the question? Oh, the blood-brain barrier?
Yeah, does it cross the blood-brain barrier?
Right, so this is something I wrote about in my book. So supplementally, you noticed on the list I gave you, I didn't actually give you GABA. GABA aminobutyric acid is a neurotransmitter, but it's also an amino acid compound that can be taken as an oral supplement. And for some people, GABA works, and for some people, GABA doesn't work. And one of the things about GABA is that GABA has very large molecular weight. That the camera's focused on my face. It has very large molecular weight, and the large molecular weight of it doesn't allow it to cross a healthy blood-brain barrier. So when you see people respond to GABA, it's a clue to us that their blood-brain barrier may be permeable. And this is actually the basis of what used to be a test for leaky gut called a lactulose mannitol test, where they had people drink a sugar called lactulose, which is a large disaccharide sugar, and normally you shouldn't absorb it, and if you absorb it, that means you have leaky gut. It's kind of the same thing. What lactose is to the gut barrier, GABA is to the blood-brain barrier. You really shouldn't have it cross if it's intact. A lot of people do have blood-brain barrier permeability, just like a lot of people have leaky gut. So one of the things is if you actually respond to taking GABA aminobutyric acid, it could suggest that the blood-brain barrier may be breached. Now, this has never been studied. This is just a theoretical model based on molecular weight. There could be GABA activation through the gut that may, for some people, have an effect on the brain through vagal pathways. So we still don't know, but I would always still suspect that if someone responded to actually taking GABA aminobutyric acid, that their blood-brain barrier may be breached if it's working for them. Now, things like valerian root, passion flower, L-theanine, lithium, magnesium threonate, they cross the blood-brain barrier. So they're going to work with your intact, healthy blood-brain barrier. So that's kind of the background on GABA. I know some people are really fixated on that. Let it go. It's not that big deal. We don't know what all the things are with it. But you should always be suspicious of a breached blood-brain barrier. If you think your blood-brain barrier is breached, you can test for it. Through conventional laboratory testing like LabCorp, Quest, most medical labs, they have a marker called S100B. S100B levels can go up if the blood-brain barrier is breached, especially after traumatic brain injury. And then Cyrix Laboratories has a panel called Array Number 20, where they check for blood-brain barrier protein antibodies, and that if those are elevated, it can suggest that the blood-brain barrier is permeable or leaky. So those are things to consider as well.
Okay. you might have answered this already, but
Yeah.
Sue's asking, thank you. Can you test for the abnormalities / stress responses, or is it just a case of looking for family history?
Well, yeah, I mean, when you look at people that have like the PTSD component of chronic anxiety, that's something I didn't really spend a lot of time on, but thank you for bringing that. Like, when you look at the neurobiology of post-traumatic stress disorder, what happens is there's such a aggressive stimulus to the brain that activates regions that neurons develop plasticity and connectivity so aggressively that pathway becomes overactive. It's in a sense what they call negative plasticity. You activate a pathway so strongly and rehabilitate it so it actually doesn't serve you well in life. It makes things worse. Um, Another example of negative plasticity would be, for example, if you hit a tennis ball wrong for 20 years and then you try to fix your tennis swing, right? So if you've been hitting it that way forever, you develop negative plasticity. But you can develop negative plasticity from psychological, emotional stresses and have chronic anxiety too. And literature has been shown this happens with soldiers, this happens with people that have been sexually abused as children, this happens with just significant stress in their life. So in that case, is the areas of the brain that deal with stress are so efficient and so geared that any little thing triggers stress. And that's why in those people, exercise, movement, try and do things like biofeedback, neurofeedback, cognitive therapies, making sure their blood sugar levels don't drop, become critical for them just to deal with their expression of their anxiety because that pathway is so wired. It's very similar to people that have genetic uniquenesses on their receptors that leads them to have anxiety.
Okay. Audrey's asking, can you speak to the connection of oxalates and anxiety?
I don't know about any relationships between oxalates and anxiety, so I can't comment on it. I don't know if they exist or not. I can't discredit them or discount them. I just don't know much about them, so I'm sorry I can't answer your question.
Okay. John Allen's asking, is there any book that discusses the science of anxiety like in detail? Anything research that anybody can look at or see?
No. There isn't any really good books on anxiety. I thought about writing something, but as you know, there's only so many hours in a day. They're kind of all spread out all over the place in the literature, and I'm sorry, I don't have a good source for you.
Okay.
Some other people can suggest something on the Facebook page if they know of a good book, but yeah. I don't.
Okay.
And to be honest with you, I haven't read a book since I was in high school.
But you've read science books.
Yeah, I mean, yeah,
is
right.
Silly the books you have.
I have reference textbooks,
Yeah.
and I read mostly journal papers, so I'm not the best expert on books out there.
I'm gonna get you some books on
Okay.
tape. Sorry. Okay. Carmen, can pandas cause anxiety?
Yes. PANDAS can absolutely cause anxiety because PANDAS involves a pathophysiology where the antibodies against the infection, whether it's streptococcus or another pathogen, injure the area of the brain called the basal ganglia. And the basal ganglia has an area called the basal ganglia indirect pathway, which has GABA projections that inhibit and calm down the anxiety centers of the brain. So if people get injury to their basal ganglia, in children, the most common cause is PANDAS. In elderly people, the most common cause is a small silent stroke. They call a lacunar stroke that can do that. But absolutely, PANDAS can cause anxiety.
Okay. Rushi is asking, do sublingual supplements work, like B12 or GABA sublinguals?
Well, sublingual supplements, as far as work, meaning they get absorbed, yeah, they get absorbed. But whether B12 or a sublingual compound is going to have an effect on you is based on too many variables. But sublingual supplements are absorbed through that path, through the sublingual pathway.
Okay. Pia is asking, what do you think about vagus nerve stimulation for brain health and anxiety?
Sure. So vagus nerve, so one of the things, okay, so there's different types of therapy to deal with anxiety. I don't have the extensive list. And actually, to be honest with that, there's so many things that are out there, I don't even know about them. Many of them I learned from patients coming in and teaching me because they've had to go on the journey to figure out strategies. And, what works for one person may not work for another person. But vagal stimulation is based on the fact that you're trying to activate parasympathetic responses. And the parasympathetic system is your calming down response. And for some people it may work, for other people it may not work. That's the difficult thing with anxiety. There's no clear therapy that works for one person to the next because of the mechanisms that are involved. For some people, for example, if they have cerebellar neurodegeneration, they do vagal therapy. It might not have any impact at all. And the only thing that may impact there's anxieties until they can rebuild their cerebellum and avoid motion and movement and those types of patterns throughout their day. So whether it works or not, it varies from one person to the next. That's the problem.
Okay. Eleanor's asking, can bipolar be misdiagnosed and really be a cerebellum degeneration?
Yeah. The thing is, whether it's any of the psychiatric or psychological imbalances that are out there can always be metabolic or neurological disease. And that's just the difficulty with, when you look at medicine in general and healthcare professionals, misdiagnosis is pretty common. I mean, even when you look at some of the top diagnostic clinics in the world, like the Mayo Clinic, Cleveland Clinic, when they do studies to look at their accuracy of their diagnosis, it's still pretty low. So this is why many people that have chronic conditions, have to see multiple people and start to try to figure things out. And it's just, human beings can only process so much as a doctor or healthcare professional, and physiological conditions are so complex. So the truth is you may be misdiagnosed, but that's common with any kind of chronic condition.
Okay, perfect. Diane and other people have asked about CBD oil, if it's good treatment for generalized anxiety.
Right. For some people, like CBD oil is something else you can add to the list. CBD has some effects. THC has better effects, but also gets you stoned. But it helps with anxiety. Those therapies can be useful. Again, it depends on. For some people, CBD will work. THC for sure will get someone stoned. For some people, THC causes more anxiety for them. It actually makes them have hallucinations and get really wired, even independent of the strain of cannabis that they use. So again, it goes back to the unique thing, but you can add THC, CBD on a potential list of things to help calm down anxiety, for sure.
Okay. So Jonathan's just making a comment saying her food sensitivities caused her massive anxiety. As her food sensitivities got better, so did her anxiety.
Right. So that's possible. So you may have autoimmunity to what's called GAD65. GAD65 is a really common autoantibody in people that have anxiety. GAD65 is an enzyme. It's a target protein on enzyme where people have autoimmune responses, and it stands for glutamic acid decarboxylase. And it's a pathway that actually allows your body to make its own GABA. So one of the things we'll see is when we do see people that have GAD65 autoantibodies, which is common in celiac disease, common in type 1 diabetics, common Hashimoto's, is that when their autoimmunity gets flared up, their anxiety gets worse. Because their autoimmunity increases their GAD65 autoantibodies, that destroys the enzyme that's necessary to make GABA, so they can't calm down their brain. And for some people, it's getting rid of their food sensitivity. For other people, it's just however they manage their autoimmunity through diet, nutrition, lifestyle that starts to calm things down. But if food sensitivities impacted your anxiety, I would be very suspicious of neurological autoimmunity, specifically GAD65 antibodies.
Okay. Yael has a question about, when you talk about anxiety, are there different manifestations of the anxiety? For example, is it always heavy breathing, shaking, gut pain, dizziness, or do some people show anxiety in other ways? And if so, does that give us more of a clue as to the root cause of the anxiety? Does symptom relate to certain brain parts?
Yes, there's some truth to that. So, for example, if someone has an anxiety attack at the same time they get vertigo, then you may know it's cerebellar disease. If someone gets anxiety issues and all of a sudden they get gut cramping and bowel sound changes, you know that there's some impacts on their autonomic vagal pathways. You can go down the list with different things, but they give you some degree of information, but not necessarily a lot of information. But whenever someone has anxiety, it's always important to kind of look at what other symptoms they have. For some people that have anxiety, you look at their resting heart rate, and it goes up. It goes like dramatically. It goes up to like 150, 160, just resting. Other people, they have psychological anxiety and they're freaking out, but their heart rate isn't really that high. Some people have anxiety, their eyes totally dilate and start sweating. Some people don't. So it's complex, depending on what different regions of the brain are involved. So yes, but I don't know how to interpret that directly relates to treatment or what to do for it.
Right. Okay, I'm asking you this one because it's important. I think people should hear this. Owen is asking, could pulling all-nighters and sleeping at different times each night lead to greater anxiety?
Yes.
Susceptibility throughout the following day or days?
Yes, I'm a case study in that.
Well, explain why.
Listen, the thing is your brain has to have rest. So here's the thing: the way your brain works is most of your brain is actually has pathways to inhibit it. So 90% of your brain is there to inhibit the last 10%. And when the brain is fatigued and tired, it's very easy to not be able to dampen anxiety pathways, which are phylogenetically survival. So that's the thing. If you haven't had enough sleep, it's very easy to get irritated. It's very easy to get angry. It's very easy to get anxiety because the pathways you need to dampen your anxiety centers are fatigued and exhausted. So your brain has to have sleep to activate those centers. So you'll definitely be more prone to anxiety with lack of sleep.
Yeah. Or sleeping at a regular time.
And,
like
and
not having
sleeping at a regular time throws off your circadian rhythms, and that throws off your neurochemical biology. It makes it less efficient. So yeah, that'll definitely be a factor.
Yeah. Okay. Lisa's asking, how do you know if it's anxiety or depression? I'm working with kids as a teacher and would love to know. Get an idea.
So there's overlap between the two because they both, first of all, if I hear depression, anxiety together, my immediate thought is frontal lobe. So frontal lobe pathways are involved with causing those issues. And in children, there's a lot of frontal lobe delays, and you also see focus attention issues, concentration issues. They may get mislabeled as ADD, ADHD, but they do overlap. That's the thing. Ultimately, it's not depression or anxiety. Ultimately, it's the frontal lobe or area of the brain that's not working. Mm-hmm. We kind of try to label them as two different diseases. One's anxiety, so you have anxiety disorder, and now you have major depressive disorder, or whatever you want to label it. But ultimately, at the end of the day, it's a brain that's not healthy, not doing its job and its mechanisms. So you really want to focus on improving brain health. But they do overlap all the time, especially when the frontal lobe is unhealthy. And unhealthy for a child would be neurodevelopmental issues. For an adult, it would be neurodegeneration issues. Or for anyone, it could be the effects after a traumatic brain injury. Okay.
So Jessica's asking, and a few other people are asking this kind of question. Is there a cerebellum specialist? Who would patients see for you're talking about cerebellum dysfunctions and, balance dysfunctions. Who would you recommend someone to see? What type of person would you suggest?
Yeah. Basically anyone that does, there's a problem with this cerebellum specialist because one part is there's a specialty that's important to diagnose it, and there's another specialty to treat it.
Yeah.
Your typical neurologists are not going to look for cerebellar or early degenerative changes. They're really more involved with looking for end-stage diseases like Parkinson's and Alzheimer's and different types of pathology, not some subtle early signs of neurodegeneration, so that's not your best bet. But sometimes a very well-trained neurologist can find early cerebellar disease very quickly, document it, and they can record it. People that do any kind of balance therapy, neurorehabilitation, people that are experts in balance and stability issues would be a very good place to go to help them rebuild your cerebellum. In the chiropractic profession, there's people that do chiropractic neurology that can be helpful. The International Association of Functional Neurology and Rehabilitation is a place you can find some of those people. So those are the main suggestions I have.
Okay. Michael's asking, what are your thoughts on using scents and essential oils to lower anxiety?
Sure. Well, that's another thing too. So using senses to dampen anxiety is really the concept of biofeedback. So whether you get light or sound stimulation and you find some way to dampen that, whether it's through breathing or to smelling scents or to moving your arm a certain way or however you can figure out how to dampen it. Aromatherapy can be beneficial for some, but not on others. Aromatherapy impacts what are called olfactory projections to the limbic areas. And for some people, if they activate olfactory projections to the limbic area, it can dampen their anxiety. For other people, it will not. So this goes back to the whole concept of trial and error, which is very, very frustrating if you're dealing with anxiety because you just, you're hoping that, you're just deficient in one thing and you take it and it fixes it, but it's not that simple. So it can work for some people, and some people, like they absolutely notice a big benefit. For other people, they're like, this is a waste of time, this is quackery, this is voodoo, because it didn't work for them. So that's their experience with it.
Sure. And can I just say, be patient with yourself. Like it's a struggle finding this stuff.
It is not easy.
It's not easy. Okay. So actually, Jonathan's asking, can you give more of an overview of what neural feedback and biofeedback are?
Neurofeedback, you go to a practitioner so you basically will work with a biofeedback therapist or a neurofeedback therapist. You're going to work with a trained healthcare professional of whatever discipline. Neurofeedback, you're going to be looking at different images on a computer screen. That's the software they use, and they have you look at your heart rate, and they have you look at different images and focus on things, and they'll kind of give you different stimuluses to start activating your brain to develop plasticity. Biofeedback, you may get different stimulus like light or sound, and learn how to breathe and focus on different thought processes or different cognitive tasks to help you deal with the anxiety responses. So those are the main things with biofeedback and neurofeedback. Something is triggering a stress response rate in your heart rate, and then you're trying to figure out how to impact your physiology to dampen that. And then you do that over and over again to retrain that area of your brain to be able to dampen with that stress response.
Okay, this is a very common question. Do you think anxiety issues correlate with problems in the gut, with gut health? They say gut is your second brain.
Yes, there actually has been papers published where they see different changes in bacterial species that have different impacts on mood, depression, and anxiety. Mm-hmm. But I'll be honest with you, it's like you don't see people totally start taking probiotics and eating a little bit better and all their anxiety goes away for the most part. Or it's I should say clinically dramatic. So I think the microbiome and gut have some impacts on anxiety, but it's really more the brain, and of course the gut impacts the brain. So I think what a lot of people are doing is wasting so much time trying to treat their gut, trying to treat their adrenals, and ignoring brain therapy, brain rehabilitation, and they have these ongoing issues. So there's absolutely gut-brain interactions. I just don't, see that. You don't clinically see a huge impact by just fixing the gut for the brain, for anxiety.
Okay, a couple more questions. Steve, Alina's saying, time to get some sleep, Matthias. There's a good app.
Thank you.
It's a good app called whoop.com for recovery and that kind of stuff.
I need it.
We're going to look into that.
I'm going to look into that. Thank you.
You are not getting sleep because you're busy. You've got to go.
You know what happens? Everyone has their issues and problems. I always think I can do more than I can, and it's a lesson I still haven't learned. And so then I commit, and then I have deadlines, and then I can't get sleep. So, yeah, we all live with our own issues. Our own times.
It's okay. We're working on it.
I am getting better.
Okay,
next.
Sure, honey.
Next question.
All right. Sarah's asking, do you have any experience using SAMe and B vitamins for anxiety? Not to mention those.
Yeah, I mean, SAMe, some people that have, so there are people that may benefit from any type of the neurotransmitter supports, like SAMe has an impact on serotonergic pathways, serotonin pathways, 5-HTP, St. John's wort can impact serotonin pathways. For some people that has something to take the edge off. Mm-hmm. I don't see it making a big difference for most people, but again, this is where individual uniqueness comes in, trial and error comes in. As far as B vitamins go, I don't really I've never seen anything in my own clinical practice where someone's anxiety goes, God, this B complex made a difference for me. This was a game changer. In over 20 years of practice, I've never seen that. So, of course, B vitamins are important for your neurochemistry and brain issues, but I don't have much clinical observation of seeing it being a big factor.
Okay, two more. Michael's asking, Is the level of antibodies in direct relation to the degree of assault to your body in your body is sustaining, specifically Hashimoto's?
No.
A little off topic.
So the degree of antibodies, in this specific case, antibodies to, let's say, GAT65, the level of the antibody isn't really related to the severity of the impact on the tissues, because antibodies are half the picture, and the other half, the other side of the picture, is what are called T cells. So antibodies just attach to the self-tissue protein to destroy, but it's really T cells that then destroy the tissue. So you could have someone that has an antibody count that is higher than another person, but this person that has a lower antibody count than this person may have really aggressive T cell responses and have much, much more tissue destruction. So antibodies themselves, comparing one person to the next, don't give you a clue. Now, your own baseline antibodies compared to yourself could offer some clues to if your autoimmunity response is coming down to some degree, but it's just, remember, half the picture, because antibodies are only measuring what's called the humoral response or the B cell response.
Okay, so instead of a question, I have a request from Susan. Can you please mention the anxiety summit you're speaking at in November? She's posting a link to it.
Thank you, Susan. I'm speaking at an anxiety summit in November. If you guys are interested in checking that out, just look at the link Susan has put up. Anyways, thank you everyone for joining us, and hopefully you found some information that's useful. Please follow us on Facebook, and please share this link to anyone you think might be helpful for them. Thank you for your time, everyone, and it's a pleasure to see all you join our group and to say hi and everything.
Yeah, everyone's really grateful for it. It's nice. It's very
Sorry
nice.
about the focus of the camera. I had to figure out why that happened. Anyways, thank you all. Bye.